If you're a parent and you have an autistic child and you're wondering what PANDAS are, this is the right video for you to watch, because in this video I will break down everything about what you need to know about PANDAS. So stay with me. PANDAS is something that every single parent is so worried about. What are PANDAS? And they heard about PANDAS and they don't know what it is, and a lot of times it actually causes confusion, and many times when parents actually go to the ABA therapist and speech and occupation therapist, even to the physician, not many of them actually are aware of what PANDAS are. And this is something which has been kind of like the name that has been given as PANDAS. This is something like a child in the autism spectrum always have certain issues with certain pathogens. So the first thing is like, what are PANDAS? PANDAS in short is for Pediatric Autoimmune Neuropsychiatric Disorder. This is always associated with a certain strep infection, and a lot of times the parents will come back and say, look, my child was fine and he had some strep infection, and then all of a sudden, just like that, everything changes and the child generally regresses quite a bit. And this is normally followed by certain antibiotics, and a lot of times a lot of things can actually happen. But this is what PANDAS are. And now, what happens when a child has the PANDAS? Now, some of the common symptoms that you may see is that the child becomes very obsessive, very compulsive, and a child cannot handle separation when a parent when someone loved one, when they go away or any separation, they cannot handle it. So the child will become very moody, and these are the things that will happen. And all these things can happen just overnight, and out of the blue, the child can develop all these things. And these are something that you need to watch out. And now, I'll give you two of the names of the pathogen, the bacteria that is directly associated with PANDAS. One of them is the Streptococcus. Now, strep is something like, we all seen like, oh, it's a common strep throat. But then what happens in a child in the autism spectrum when a child has the strep? These pathogens are very elusive, and here's something what they do. They hide themselves. They hide and they kind of mimic certain other cells like the heart cells, like the brain cells, or some of the tissue cells. They actually kind of mimic themselves. They kind of camouflage and they hide. So the immune system finds it very difficult to spot them and to destroy them. And these things can stay in the system for a long time. And as long as these pathogens they are there, the symptoms will be there, and it's actually very difficult to identify and to eliminate these pathogens. And because of the way they are, they're quite elusive. They are, it's very difficult to find them, and they hide very smart, and that's what these pathogens. That's what they do. Now, the next thing you'd ask me is like, will an adult have PANDAS? Now, it's very hard to say. But there are some cases that has been reported where PANDAS it is found in some of the adults who have similar autistic symptoms. But then the problem with an adult is like it's very difficult to tell like if a person has falls in the autism spectrum. But then they can have some of the other symptoms of it, like yes, one of them is OCD, yes, and dyslexia. Some of them find it difficult to read, to concentrate, focus, but then these symptoms can be anything. So it's very difficult to say. How are PANDAS diagnosed? This is something, it's a big question, and it's a mystery for even for healthcare professionals to try and identify these pathogens. I really don't know how a lab test can actually find, and they'll be able to pinpoint and tell you like if these pathogens are present. But then in most cases it's actually quite difficult to find these pathogens. And these pathogens, the Borrelia, the strep, which is quite common, but then these are the ones that actually do much of the damage. So if you do find, but I would always tell the parent that if you do find that your child has these symptoms, then my assumption is that yes, your child will have this. And that's one of the protocol that I always insist on in the autism, is like not only just the food, but always look into pathogens. Pathogens, when I talk about pathogens, it's viruses, bacteria, funguses, parasites. And these things create havoc. They actually create a lot of toxin overload in a child, and these all translates into behavior. And a child doesn't know how to express these things, and so it breaks out as symptoms. And so some of the symptoms, like which normally they would show, is tics and stims, and irritability, and can't focus. There is learning difficulties, not able to concentrate, focus. A child will have a lot of problems with school. And well, ask any parent with an autistic child, they will be able to narrate every symptom in the Autism Spectrum Disorder. So what is that you need to do? Well, the first thing is what you need to understand is that there are no specific tests for PANDAS. And the general thing is yes, these are the pathogens that are there, and the way forward is you actually go and eliminate them. Now, the process of elimination is something that a child in the spectrum will always have a reaction to any sort of anything that is being introduced. A child will have a child can regress, and sometimes some of the strong antibiotics can also influence the child's behavior. So I would always recommend go for non-invasive methods where you can identify, you can remove these pathogens. And I always find herbs as a great substitute for many of the things. And there are ways where you can actually eliminate these bacteria, and you can actually get rid of them. And I've seen, especially in my son's case, that I used to work on these pathogens and specifically, work on them individually. And I've worked on it for months, and I could see a huge difference every time when I work on my child, and I see the difference. And that is when I knew that how much these pathogens would actually, dare to invade my child and take away my child from me. So it's very hard. It's very hardening. It's very difficult as a parent to go through all these things. So don't worry, there are ways. I'm sharing my experience with you so that you don't have to go through all these things. And what I'm going to do is the next video I'm going to talk about Candida. And Candida's overgrowth is something which I learned a lot about it. And in the next video I will talk about it. So goodbye.